50,000 people in the United States have died of the COVID-19 disease.
The World Health Organization reports that those who test...
What happens when you add a worldwide pandemic to another public health crisis? For those struggling with opioid addiction, the current coronavirus presents a whole new set of problems. Across the country, quarantine restrictions create major challenges for people with opioid use disorder, making healthcare officials worry that self-isolation will result in a surge of opioid-related overdoses.
What we're seeing is a higher rate of prevalence of use, and that higher prevalence of misuse and abuse and addiction of substances occurs in parallel with times of great unemployment and recession. And so that's what we're anticipating, is that there's going to be a higher prevalence because of this economic downturn, and also times of psychological stress and anxiety are really connected in parallel to substance misuse, abuse, and addiction.
This is Courtney Hunter, the Vice President of State Policy for Shatterproof. Shatterproof is a national nonprofit that focuses on addiction prevention, treatment, and recovery.
The other concern during COVID and people self-isolating is people overdosing and not calling 911, or first responders taking much longer to get there just because they're inundated.
With this increased risk of substance abuse and overdoses, addiction treatment centers are adapting their programs to adhere to safe social distancing measures. Treatments that use methadone and buprenorphine, two FDA-approved drugs to curb opioid withdrawals, normally have to follow strict federal and state regulations because of their high risk for misuse. Patients who take these medications are usually required to attend frequent in-person counseling sessions, and methadone is so heavily regulated that it is only available for in-person dosing at federally approved clinics. But recently, many states have temporarily relaxed these regulations. Matthew Donlan, CEO of the Addiction Treatment Center of New England, explained how the Brighton-based facility readjusted its medication treatment programs under quarantine restrictions.
There's guidelines from both the federal government and the state on what we can do as far as take-home medications. So with the pandemic, that's all been rearranged. So basically now we've done what they call emergency take-homes. So sometimes it happens in like inclement weather, things like that, where you do a blanket waiver for take-home medication. And basically that's what we had to do. The federal government and the state have allowed us to put in blanket waivers for take-home medication. So,
although Donlan said the facility has not come across any issues so far with the take-home dosages, the center has encountered other obstacles, including limited health supplies among staff.
We're lucky enough to have some stock of masks and hand sanitizer and gloves and things like that, just because of the nature of what we do in our population. But now getting close to being a month into it and having absolutely none available to purchase, we're definitely getting down to the bare bones of what we had put away.
Despite these challenges, the clinic is still accepting new patients looking to enter treatment. More people are turning directly to the treatment center for help instead of local hospitals out of fear of catching the virus.
What's happening is we're finding more people coming to find treatment because, number one, the supply chain for opioids, illicit street opioids, is kind of diminished. So they're not able to buy drugs as easily as they could pre-pandemic.
COVID-19 also presents serious dilemmas for people not in medically assisted treatment programs. Social isolation completely disrupts the dynamic of 12-step groups like Narcotics Anonymous that heavily depend on weekly in-person meetings. As a result, Narcotics Anonymous meetings now take place over Zoom video chat.
I think people really rely on that person-to-person contact, those meetings, whether they're in a church basement or, at a healthcare facility. It's also their routine and the schedule that's really important. And, people are waking up and they're going, what day is it today? So not having that sense of schedule and routine can be incredibly disruptive for someone who's in recovery and who relies on that to get from one day to the next.
For a population that depends so heavily on daily stability to overcome the chaos of addiction, the pandemic poses massive challenges. Recovery from addiction may have relied on consistency in the past, but it now looks like that may change given the inconsistency of the current COVID-19 crisis.
We're doing our best. There's no blueprint for this, right? There wasn't any policy written about what we do in the pandemic. I guess we're all kind of learning as we go.